I'm going to talk about the twin pregnancy. A twin pregnancy lasts 37 weeks in general, usually without serious problems. But because there's a higher chance of complications, the pregnancy will be monitored more frequently. This is what the frequency of the monitoring usually looks like. Until 16 weeks, every 4 weeks, from 16 till 28 weeks, every 3 weeks, from 28 till 34 weeks, every 2 weeks, and from 34 weeks, you need to see the doctor every week. During those visits, the ultrasound is often used to follow the growth and development of the unborn children. Until 13 weeks, it is visible whether or not the babies share their amniotic sacs. If they share both the inner and outer amniotic sac, there's an increased chance of complications during the pregnancy. After 13 weeks, the chance of losing the fetuses decreases enormously. At this point, most women start to feel more energetic. And that's good because usually there's still a lot that needs to be done to get organized. And you want to get well prepared on time because there's a high chance that the children will be born premature. To avoid problems during the pregnancy, women are advised to slow down at 20 weeks. So see if you can work less, no more night shifts, and try to take a nap every day. At 24 weeks, if the children are born, there is a survival chance, but the risks are still extremely high. So treatment will be to avoid preterm labor. However, at 28 weeks, the survival chance has increased, and sometimes there is a reason not to prevent early labor, depending on the condition of the mother and the babies. At 34 weeks, medically there is no reason to avoid preterm labor. If the babies are born before 37 weeks, usually they have a low birth weight and they have to stay in the hospital for a couple of weeks or at least a couple of days. If the babies are born at 37 weeks, sometimes you can take your babies home on the day that they are born. But there's also a chance that they have to stay in the hospital for a couple of days for monitoring reasons. If at 37 weeks labor hasn't started spontaneously, you should talk to your doctor about inducing labor, because past 38 weeks the babies are post-mature. Waiting any longer will increase the chance of complications, so you don't want to wait.